Hello everyone and welcome again. My name is Ayodele and welcome to my channel. If you haven't subscribe to Ayodele and go and watch my videos where I talked about disease conditions in the simplest way that you can understand. From watching these videos, you can save lives. You can save a life, you can save yourself, you can save your family members. So if you haven't subscribed, do subscribe, watch, share, comment on my videos, and I will be glad you've done that. All right, so welcome back. Today, we'll be talking about a very common disease condition, which is heart failure. Yes, which is heart failure. When someone has a heart failure, that doesn't mean the heart has stopped working. It means your heart isn't pumping blood as well as it should. It is different from cardiac arrest when the heart stops working. But heart failure, it means that the heart isn't pumping blood as well as it should. Millions of people live with heart failure, like I said earlier, but many don't even realize they have it. Many don't realize they have it. So today, let us break down what heart failure is, the warning signs, and how you can manage it. So come with me and don't be distracted. All right, what is heart failure? Heart failure is a condition where the heart is too weak or too stiff to pump blood effectively. That is just the simplified meaning of heart failure. When the heart is too weak or it is too stiff to pump blood effectively. Think of your heart as a pump. If the pump is weak, blood backs up and fluid builds up in the body. This can cause swelling, fatigue, and even trouble breathing. And that is because the pump that is supposed to pump the blood to the whole body system is weak. So there is what should I call it? There is build up. Yes, there is build up. The blood is not flowing, it's flowing back when it's supposed to be going throughout the body. So that is heart failure for you. There are two main types of heart failure. We've got the left side heart failure. The left side heart failure is the most common. The left side is the most common because this causes fluid buildup in the lung. It causes fluid buildup in the lungs, leading to shortness of breath. Leading to shortness of breath. That is what if anybody has got the left-sided heart failure, that person is going to be having fluid buildup in the lungs. Then the right-sided heart failure. This follows the left-sided heart failure. And this causes fluid buildups in the legs, in the abdomen, and in the liver. It causes fluid buildup in the liver, in the abdomen, and even in the legs. It starts off with the left-sided, which builds up fluids in the lungs. Then from there, it goes on to the right-sided, where the fluids are built up in the liver, in the abdomen, and in the legs. That's when you see the legs, big size. So, heart failure can be chronic, which is the long-term one, and it can also be acute, which is the sudden and severe one. It can be acute, it can be chronic. Heart failure often develops after other conditions. So all of the other conditions that has already weakened the heart will end up with the failure, and that is where heart failure comes in. So what are the common causes of heart failure? Anybody that has come down with a heart attack, the heart is weak already. This can lead to heart failure. Anybody that has a high blood pressure, the heart is weak and can come down with heart failure. Anybody that has got diabetes can come down with heart failure. Anybody that has all these heart valve diseases, all these conditions of the heart can come down with heart failure. All these people that are obese, that have a lifestyle problems, they can come down with a heart failure. So these are the causes of heart failure. So what are the signs of heart failure? What are the signs of heart failure? The first one is that shortness of breath, especially when they are lying flat and they are laying down, but they can't breathe well. They're still having shortness of breath. That is a sign of heart failure. Another sign is fatigue and weakness. The heart is stressed, the heart is weak. So definitely that person will be weak and fatigued as well. That person will be weak and fatigued as well. Another sign is swelling in the ankle, in the leg, and in the abdomen. Like I said earlier, in the right-sided heart failure. There is swelling in the ankle, in the legs, in the abdomen. So these are signs that the heart is failing and something needs to be done on time. So another thing is rapid or irregular heartbeats. You will know when your heart is not beating properly. You will definitely know when your heart is not beating properly. So when you notice this thing, the best thing you can do is to go to your hospital. Go and see a doctor immediately. Another sign of heart failure is persistent cough or wheezing. Persistent cough or wheezing, that might be as a result of fluid buildup in the lung. Fluid buildup in the lungs. So another sign and symptoms you can say is a sudden weight gain, and that is fluid building up in the body. So you just see that that person suddenly becomes big. There is fluid buildup in the face, in the abdomen, in the legs, all of that. That is a sign of heart failure. That is a sign of heart failure. How do you treat this heart failure? How do you treat it? The first one is medications like diuretics. Diuretics are medications that help to relieve the fluid in your body. You go to have a wee as much as possible so that the build-up in your body can come out. They are called diuretics. That's a medication. Another thing is lifestyle changes. Limit your salt intake. Another thing is checking your weight, tracking your weight to know that you are not suddenly gaining unnecessary weight. To know that you are not suddenly gaining unnecessary weight. Another thing you can do is exercise gently and regularly. You don't have to do too much. Gently and regularly makes the difference. Gently and regularly makes the difference. So another thing you can do is to quit smoking and limit alcohol. They do more harm than good in your body system. They do more harm than good in your body system. What you can do again is to take medications as prescribed. Yeah. Take medications as prescribed. Don't take it according to how you feel. Take it as prescribed to prevent heart failure. Heart failure sounds scary, but it doesn't mean the end. With the right treatment, with the right habits, you can actually manage it well. With the right treatment and habit, you can manage it well. So, what is my challenge for you today? My challenge for you today is if you or someone you know experiences shortness of breath, swelling in their legs, in their abdomen, in their face, don't ignore it. Let them get checked early so that it can be treated on time. Thank you for watching. If this has helped you, kindly subscribe, share this video, comment, and watch and join me on my next video on disease conditions in the simplest form. Thank you very much. Bye.